Peace be to you all. Assalamu alaikum, Omar here. I wanted to talk to you guys more about mental health. As I've stated before, this is Mental Health Awareness Month from May 1st to the end of May. So there's a lot going on with mental health, obviously with mass shootings and, certain cultures that, where we're questioning who's what, that kind of thing. And does what they're saying they are, does that count as a mental health issue or not? Hi there, how are you? So I would tell you this as somebody who was trained in mental health as a physician assistant, part of my training. So I went to PA school more than 20 years ago. I graduated in 2000. And before that, I was a nursing student back in the early 90s. Early 90s. We were trained on something called the DSM-3, so the Diagnostic Systems Manual. And that would tell us, things like personality disorders versus psychiatric disorders and behavioral disorders. And included in that was a whole constellation of various what were called disorders. Everything from bipolar, depression, schizophrenia, drug abuse, different types of gender identifications, operational defiant disorder, that kind of thing. And we had to learn how to distinguish these things, not to the level of an expert, not to a psychiatrist who has a medical degree and did a residency in psychiatry, or a psychologist who has a PhD or a PsyD. But we learned at least some of the working basics of mental health. And that segues into, what to do if you have patients or somebody who may have mental health issues, especially in the professional setting. Like me, I work in internal medicine with adults. So if I see people who will tell me that they feel depressed most of the time, they feel like killing themselves, or say, okay, maybe that's depression, maybe that's bipolar with depression. Maybe they have, if they're hearing voices, maybe they have schizophrenia or schizoaffective disorder. There's many different, there's many different subtypes in each of these diagnoses. So what it's my job to do is to, I refer people. A lot of the patients will ask me for various medications. Hey, can you give me some Xanax? Can you give me some, if I had somebody ask me for Suboxone, I said, well, I'm not licensed to distribute, to write prescriptions for Suboxone. That's what you give people who are recovering from heroin in lieu of methadone. But I was like, well, let me refer you to an expert in this field. So I will refer you to psychiatry. Every once in a while, I may give something, one of the psychiatric medications, if a person needs a refill and for whatever reason they can't meet with their psychiatrist, and they may have an appointment and the psychiatrist isn't, they're not going to be able to see the psych doctor until a couple of weeks and they're out. So I'll say, okay, look, here is Xanax or something. So as a PA, I'm trained to do that, and with my license, I'm able to do that. As far as my supervising physician has allowed it, but I'm not a psychiatrist, so I refer the patients. And if it's an initial encounter and the person's telling me that they have symptoms of psychiatric illness and they want to talk to somebody, can they talk to me? I said, well, it would probably be better for you to see somebody who is an expert in this field. So we'll chat a bit. It's called taking a history, and then I'll maybe during the physical exam I might see marks in their arms where they've cut themselves with razors. But there's another condition where a person will take tweezers and they're convinced that they've got bugs in their skin, so they've been pulling out pieces of skin over the years. Or they're feeling dirty, so they wash with bleach, you know, and maybe they were molested as kids and they're like, you know, I felt dirty, so I washed myself with bleach to get the dirt in the cell. That's very sad cases that I've seen over the decades. But I have to refer that person. You know, when we take the Hippocratic Oath, we say, do no harm. So you don't want to do harm by trying to take on a role that you're not trained for. So you have to know when to refer. And you know, there's a lot of these advertisements I've seen on the internet with mental health groups. So you can maybe refer the person to a mental health group as well. All right, that's it for now, guys. If you want to be a PA or a health educator like me, so my master's degree is in a physician assistant. My doctorate is in health education, AT Still University. You can reach out to me. I'm on. I'll put my email in the description. But I wish you guys the best of success in your positive endeavors. Take care. Peace.